The global fight against AIDS takes center stage on December 1st as the world marks the 36th annual World AIDS Day. In St. Lucia, medical officials urge the public to reflect on lives lost to AIDS and its related complications, and to embrace the call to action inspired by the 2024 theme.
The theme this year is Take the Right Path. From the start of the AIDS epidemic about 43 years ago, the Joint United Nations Programme on HIV/AIDS, UNAIDS, estimated that 78 million persons have become infected with HIV and 35 million persons have died from AIDS-related illnesses. According to UNAIDS, the world can end AIDS if everyone's rights are protected. With human rights at the center and communities in the lead, the world can end AIDS as a public health threat by 2030.
Dr. Gail Gajada, Senior Medical Officer in the Infectious Diseases Unit of the Ministry of Health, emphasized the importance of safeguarding human rights. She highlighted the need to uphold the dignity of those living with or affected by HIV and AIDS, while working to reduce vulnerabilities across society.
Human rights can determine the degree to which individuals are protected from HIV infection. A lack of respect for human rights fuels the HIV epidemic and increases its impact. Under international human rights laws and treaties, every person has a right to health and to access HIV and other healthcare services. Stigma and discrimination based on health status, including HIV, are human rights violations.
The health professional expressed concern over human rights barriers that leave many marginalized, stigmatized, and vulnerable to HIV. She underscored the need to protect, promote, and respect human rights as cornerstones for effective response to the HIV epidemic.
St. Lucia has been a member of the United Nations General Assembly since September 18, 1979, and follows the Universal Declaration on Human Rights. The right to confidentiality is important, and Article 12 of the Declaration speaks to this. Article 16.1 states that everyone has the right to marry and found a family. All persons living with HIV have the right to have children, and in St. Lucia, medication is available that women living with HIV who are pregnant can take to reduce the risk of transmitting the virus to their unborn child. Another basic human right is the right to treatment, and Article 25.1 states that everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care and necessary social services.
St. Lucia offers comprehensive treatment and care for HIV, including access to antiretroviral therapy, essential medications, diagnostics, and treatment for opportunistic infections.
Currently, there are just under 1,000 persons living with HIV in St. Lucia. Of those persons, only 284 are actively collecting their antiretroviral medication. Those 1,000 are the known diagnosed cases of HIV. There are persons who are undiagnosed and thus unaware of their HIV status. And anyone who is sexually active and is at risk for contracting HIV and other sexually transmitted infections. 16 persons died from AIDS-related causes in 2023. Just think, an HIV-positive person can be you, your child, your parent, your sibling, your spouse, your friend or your co-worker, anyone. As we reflect on taking the right path for World AIDS Day, consider this. By protecting everyone's right to health, through ensuring equity in service provision, and eliminating stigma and discrimination, we can achieve an AIDS-free St. Lucia.
As the world unites to combat HIV, St. Lucia's health officials stress the urgent need for collective action, awareness, and support to bridge treatment gaps and uphold the dignity of those impacted by the epidemic. Solange Alfred, HTS News Force.